So let's go ahead as an HRT pro and talk about a telehealth scenario that I think is a perfect example of things gone wrong. I'm not going to name the specific company, but I think y'all should be educated on this. They are only doing symptom tracking, period. So a patient who thinks she's in perimenopause, who's not even transitioned to menopause. Let's start with perimenopause is the most complex management. Okay, to take that person now, only use symptom questionnaire, have them fill it out, and just give them HRT anytime they complain of just fatigue, for instance, which could be multimodal or multifactorial. To only sit here and keep increasing their doses of what you're prescribing them is pretty scary. That's not the answer. That's not critical thinking. Secondly, ultimately, don't even look at labs. They're only looking at symptoms. But I had this case scenario where I did, order labs. I looked at a patient who was getting managed. This part was astounding to me. No actual testosterone given to the patient. Of course, estrogen was given, progesterone was given. Testosterone was not prescribed. Instead, DHEA capsules were prescribed. Now, I do use DHEA rarely, sometimes for certain very, very, very select patients. But you got to know DHEA, how it works. It has a 4 times affinity over testosterone to bind to certain receptors, DHT receptors. It is more likely to present with acne, hair loss, all those androgenic testosterone side effects that women don't want. So while number-wise on the lab panel, it might look quote-unquote okay, like the number we'd want it to be if we had given someone testosterone, the route and the pathway to elevate that testosterone was incorrect. It can present with a lot of mood symptoms, irritability. So if your DHEAS, your testosterone is incredibly high, you are going to present with some level of irritability, okay? Not a calming effect. At the right level, it can be very calming, make you feel happy and motivated, but at the wrong level, not a good idea. The other thing is, in this particular patient, I did measure the DHEAS level and it was extraordinarily elevated, far beyond even what happens physiologically in PCOS patients. What does that mean when that presents in PCOS patients when their testosterone level is actually elevated because of their disease process, which is now known as PMOS, by the way? But it's contributing not to improving their metabolism, but the opposite. It contributes to insulin resistance, to metabolic syndrome. So balance, understanding the route is the key, right? Not just at this point reading the lab and saying, oh, DHEA made my testosterone go up and resolve some symptoms. When you're in a state of deficiency and you're feeling terrible with a lot of your symptoms, anyone can give you any hormones at whatever dose they think is correct, and you will feel a little bit better initially. Ultimately, though, over time, you're going to adjust your lifestyle around this. And I've seen this again and again and again. You're going to suddenly say, oh, I need to start breathing. Oh, I'm having more anxiety. Oh, I need to do this. Oh, I'm feeling more tired. I need to chase it with more coffee. I'm making adjustments. You should not be making adjustments to chase side effects. That's a red flag right there. Something's off. That's just a little lesson in how telehealth can go wrong with HRT.